The Alan Walker Cancer Care Centre at the Royal Darwin Hospital continues to lead the way in cancer care in the Territory through a new radiation therapy technique that minimises the risk of side effects to the heart in breast cancer patients.
The technology which we're using here is quite innovative. It is very much adaptable to this type of machinery which we have here, and it's really only been available in the last 12 months. So I think we're certainly one of the first departments in the country to use this technology, which we're very impressed with its usability. Well, this is technology aiming to minimise the radiation dose that would be received by a patient to their heart when they're having breast radiation therapy. Well, today we're in a radiation oncology bunker where we're preparing for a treatment for breast cancer treatment with radiation. Now, a standard treatment, we would use a setup where patients have what we call just comfortable shallow breathing. And in that position, there are some of our patients who would have a small part of their heart which might be inside the radiation beam. If patients take a deep breath during treatment and hold that breath for a very short period of time, the heart moves away from the radiation beam, and so we can minimise the radiation dose that the heart receives. So that's what we're using this technology to achieve, that where we can ask the patient to take a comfortable deep breath and hold that breath during a short period of time, and that will allow us to deliver the radiation in a very safe way and outside the radiation beam. Now, this technology we've got here, which we can see on display, which involves a visual screen positioned in front of the patient, allows the patient to see where the breathing pattern is during the course of the treatment while they're holding the breath for up to 20 seconds, which is very achievable. If the patient can't hold the breath for that period of time, they're able to breathe out. We can stop the treatment immediately, and we can resume the treatment when they're comfortable to breathe in again. We've been doing this here for the period over the last 3 to 4 months when the technology became available here. Until that time, we had to look at patients perhaps going interstate if they needed this treatment, if that was going to benefit them. Now, with this availability, we can deliver the treatment here in the Territory, and it makes it much more convenient, and we can deliver that treatment where it's beneficial for the patients. When a patient will come into the room, we'll set them up in a comfortable position that we record each day, confirm that position is correct and accurate. Therapy staff will guide the patient through that. They'll set all the apparatus and machinery in the right position. When we're comfortable, the patient is in a comfortable position and everything is in position as it should be, staff will exit the room for a very short period of time, but they're able to communicate with the patient from outside the room via cameras, via microphone, and the patient will have the feedback that they can see on the visual screen as well. Typically, a patient would have an appointment which will be a 15-minute appointment each day, which involve coming into the room, being set up in position, checking the position is accurate, delivering the treatment, which usually is of the order of 1 or 2 minutes, and then leaving the room. So we allow a comfortable 15 minutes to achieve that. Many times we can do that within a much shorter period of time. Treatment normally is Monday to Friday, and standard treatment would be anything from 3 to 5 weeks for a period of treatment on a daily basis. The availability of accommodation is here so that patients have got their own space to stay. There is transport which is available for patients to come each day where they are assisted in coming directly from where they're staying to the centre, so that they haven't got to find their own transport or mechanisms. Of course, patients may have family that they can stay with. They may much prefer that, and we understand that that would be the preference for a lot of people. But where that is not available, we can provide the accommodation and transport costs, and so try to minimise the disruption and the difficulties that might be there otherwise with finding their own space or place to stay.
The Alan Walker Cancer Care Centre has been delivering high-quality treatment to Territorians since it opened in 2010, carrying out more than 55,000 treatment episodes.